Good morning, Dr. Azlin. We are the group that are going to present the topic of patient-centered care, one of neurology rehabilitation. Our group member consists of Lee Min Lee, Tae-Wan Yi, Marina Wong Mei Ying, Sua Lee Min, and Angela Tan Xue Yi. What is patient-centered care? Patient-centered care is a respectful of and responsive care provided to individual patient preference, needs, and values. The care ensures that all clinical decisions are guided by patients' value. Patient-centered care is the active involvement of patients and their families in decision-making about individual options for treatment and design of new care models. There are several criteria that involved in the patient-centered care. First, we should respect patients' values, preference, and express needs, including an awareness of quality of life issues, involvement in decision-making, dignity, and attention to patient needs and autonomy. Next, we also should provide best treatment by respecting patients' culture, belief, race, and gender. In patient-centered care, healthcare providers should also ask patient consents to have the treatment through informal discussions, while patients have their rights to refuse or withdraw the treatments. Coordination and integration of care across clinical, ancillary, and support service should also be performed well in patient-centered care. Information and education on clinical status, progress, prognosis, and process of care in order to facilitate autonomy, self-care, and health promotion. Besides, physical comfort and good social interaction with patients should also be considered in patient-centered care. Balanced decision-making from patient and healthcare providers is also one of the criteria. Patients need to know about the risks, outcomes of measure, and understanding about their problems, while healthcare providers need to understand patients' goals, daily activities, occupation, and other important information. Healthcare providers also need to present patients with prevention and healthcare promotion activities to prevent the recurrence of the disease. In this care, patients also need to collaborate with physiotherapists to develop their self-care or home care regimes. Good social interaction with patients is also one of the important criteria that needed to involve in the patient-centered care. Other than that, emotional support is also one of the important criteria that should be involved to alleviate the fear and anxiety of the patient, while involvement of family and friends is also important in decision-making, awareness, and accommodation of the patients. Besides, transition and continuity as regards information will help patients care for themselves away from a clinical setting, coordination, planning, and support to ease transitions. Last, patients need to know how and where they can access care when needed, usually focusing on ambulation care like access to location of hospital, clinics, and physician office, availability of transportation, availability of appointments, and ease of scheduling appointments. Next, I will pass to Wadi.
Right, thank you, Li Min. So why is patient-centered care so important? It is because in this care, every treatment plan will be customized based on patient's specific needs. And so the treatment will be different from each patient, even with the same neurological conditions. In order to achieve this, we will focus on biopsychosocial model, where we will take patients' physical, psychological, and social issues into consideration while planning a suitable intervention. Therefore, there is a need to recognize patients' experiences, demands, as well as goals in terms of their difficult new reality, and keep modifying intervention based on patient status. This is really essential to ensure patients get the right intervention at the right time and in the right place for early achievement of independence and better quality of life. The next importance of patient-centered care is the establishment of productive therapeutic interactions between patients and physiotherapists. In this care, we will embrace patient-centered communication by listening to and speaking as well as acting in a way that the patient can understand. We'll be openness to provide truthful and accurate info so that patients are always informed about the treatment plans in order to support them in decision-making. We'll also treat all the patients with compassion and respect throughout their care without any discrimination. In short, we stress patient engagement in intervention plan as we provide treatment in partnership with them, not just simply given to them. As a result, we, the patient and physiotherapist together, could achieve shared goals, shared knowledge, and mutual respect, which are essential in neuro rehab when the treatments for neural conditions are usually long-term. Other than that, the importance of patient-centered care is to promote more effective outcomes with neurological intervention with greater satisfaction of patients and physiotherapists. In this care, we'll focus on dignity in care and provide emotional support throughout the intervention to let patients feel more supported as well as comfortable upon services, as we believe that with psychological well-being, physical recovery will in turn be improved. At the same time, patients will be more educated on prevention and risk factors of injury in this care. We'll gain trust and confidence from them when the services are trustworthy and reliable, avoid any wastage of resources. Only then, smooth progress and efficiency of neuro rehabilitation program can be assured. Right, so now I'll pass to Marina.
All right, thank you, Wani. So patient-centered care, it can be observed and ensured in a few patient management processes, including when we are doing assessment subjectively and objectively, in our planning of the treatment and also implementation of the treatment. In terms of subjective assessment, we want to make sure that we have a clear and effective two-way communication with the patient. So as a healthcare professional, we want to ensure whether the communication with our patient has been clear and in a language that the patient that they themselves understand. So we have to question ourselves whether we have been giving the option to the patient to involve a support person or an interpreter during the consultations. And as a physiotherapist, we want to ensure that the patient's cognitive and awareness status is stable in order for us to learn about their expectations and concerns that arise. So for this, we'll be playing a scenario. So with that, I would like to invite Min Lee as the therapist and me as the patient.
Hi, Mr. Bin. I'm your physiotherapist for the day. My name is Tina. Is English okay or do you prefer Bahasa?
I'm very comfortable speaking in English.
So before we start with our treatment, I will be asking you some questions. Is that okay?
Yes, definitely. Alright, so that is how we see that the communication is clear for both the patient and the therapist. Next, so another example from the subjective assessment is we want to use a holistic approach when we are questioning our patients. So that includes asking questions regarding their social history, their occupations, whether they have enough financial support, what about their main concerns, their home setting, household relationship, transportation to our healthcare facilities, and also their day-to-day functional activities. These are a part of the holistic approach that we're going to be asking the patient. So for that, we're going to play out another scenario, and I invite Min Lee.
May I know what are you working as?
I am a retiree.
Can I know how is your house setting? Any stairs? How many people are living with you?
I live in a single-story house, no stairs. I live alone. And so with that ends the scenario, and that is how we see that, how the patient can see that we are truly concerned about their well-being wholesomely. And next, moving on with our objective assessment. So one of the first examples is we want to make sure that we're always maintaining the dignity and privacy of our patient. So when we're doing objective assessment, in which the patient may be exposing themselves or we are touching the patient, of course consent is important, but privacy as well. So I want to make sure that we give them extra privacy when we're in a overcrowded spaces, alright, and we look away while they're getting dressed. And by doing all of this, we are respecting them, and this will greatly enhance their overall satisfaction. So we'll be showing an example of how we can give them privacy. Alright, so as you can see, we're going to pull the curtain, make sure that it is shut tightly, or if we have a room, we'll shut it tightly when the patient is exchanging maybe their robes or something, or their clothes. And with that, I'll pass it on to Min Lee.
Alright, thank you, Marina. So now I will continue with the second examples of involving patient-centered care in objective assessment is to give the explicit instruction and explanation to our patient. So what do we consider as explicit instruction and explanation? Firstly, we must ask the consent before we want to touch our patient for palpation or check tenderness. Next, we need to explain every process clearly to our patient. Like when we need our patient to take off their shirt, we need to explain clearly to them why we need them to do so. After that, we need to explain the purpose of each assessment clearly. For example, if we want to do a pinprick test, we need to explain why we want to use the needle to poke them. So here is the two examples of the objective assessment. So the first, sir, I'm trying to observe your range of motion of your elbow joint. Tell me if you feel any pain. So this physiotherapist is trying to explain what what is he doing to the patients. So the next is Mr. Kenny. This is an X-ray of your mandible joint, which is basically your jaw. From the X-ray, we found no abnormalities. So this physiotherapist is explaining the result of the finding to the patient. So well, how do we involve the patient-centered care in the plan of treatment? So firstly, we need to ensure all information is delivered transparently and fast to our patient. So we need to make sure the patient is well aware of the treatment plan, including the following, like the possible side effect, the risk, the benefit, the advantages, and disadvantages. Patients have their rights to know all about their treatment. We cannot just tell them about the good side and hide the bad side from them. So the second example is we need to prioritize patient goal and actively involve them in the treatment planning. So we need to involve the patients and patients' family members or caretaker in planning and decisions making, meaning that we cannot just make the decisions by our own. Next, we need to take into account patient needs and preference. Lastly, we need to ensure the missions and value are made aligned with patient goals that are being prioritized. So why we need to do so is when patients are fully informed, giving the trust that comes with sharing all the relevant facts, they will feel more empowered to take responsibility for the elements of their cares that are within their control. Next, I will pass to Angel to continue.
Alright, thank you, Millie. Now I will talk about the treatment implementations. One of the examples for treatment implementation is when therapists give the treatment to patients. Therapists must make sure the care given focus on physical comfort as well as emotional well-being. The therapy should include the biopsychosocial approach in treatment given. The biopsychosocial approach systemically considers biological, psychological, and social factors and patients' complex interactions in understanding health, illness, and healthcare delivery. Furthermore, therapists must have collaborative care within a multidisciplinary team. What is the meaning of multidisciplinary team? Multidisciplinary refers to the fact that many different disciplines work together to achieve a common goal, which can include doctor, nurse, and occupational therapists. Besides, therapists must monitor patients' condition throughout the treatment. For example, when patient is doing exercise, therapists must always notice patient's facial expressions or immediately stop the exercise if the patient complains any pain. Next. So this is one of the situations. Mimi have been staying in the hospital to heal tibia fracture. Throughout her treatment, her physical therapist used patient-centered care. During treatment, she routinely checked what Mimi's pain level is and asked her about any concerns she has regarding her recovery. Next. Okay. Moving on, the second example, which is education for patients regarding the treatment given to make sure patients have continuous support and regain patients' independence and return to normal daily life. Education is important to allow patients to self-manage in the long term by home care or self-care. Firstly is continuity and transitions. After we educate patients about the treatment given, we must make sure that the patients will do the treatment such as exercise in continually or transitional after they discharge from the rehabilitation center. Besides, the treatment regimens should be clearly outlined and understood by patients. Make sure the patients understand all needs for exercise, diet, continued therapies, and similar concerns. Besides, therapists must get the clear feedback process from the patients. Therapy should follow up the patients regarding his process or any unforeseen problems. Next. Before patient discharge from the ward or any rehabilitation center, therapists will give bullet for continuous home exercise program or even explain better to make sure patients will be able to follow the treatment prescribed. Next. So here is some reference for today's presentation. Yeah, so that's all for today. Thank you.